And these companies, how we define them within Lunger is they're called health tech companies. Now, to do a level set, we define health tech as 51% of your revenue has to be coming from a tech-enabled product or service that addresses a pain point for a patient, provider, payer, or hospital system, and there has to be an AI component. So I'll ask you this.
All right, hey everybody, welcome back to another Study Wealth podcast. Serge Berger here from thestudytree.com. We're going to talk about AI once again today, and we're going to do it today with my friend Dhruv Vig. We met about a year ago. He's from Lunger Holdings, and we are going to look at AI through the lens of investing a bit more specifically in the healthcare space. But there's a lot of stuff that Dhruv and I have in common. I think in terms of our thoughts around the investing landscape and so on and so forth. So Dhruv, welcome to the podcast.
Yeah, Serge, thanks for having me, man. Excited to sit down with you finally. We've been trying to make this happen for the last 1 year. Our schedules finally aligned.
It's been a while, but I think you have, first of all, an impressive background academically and in the real world. So maybe if you could give us just a little bit of perspective of kind of where you come from. I feel like it's always good to know kind of where someone comes from so people can kind of follow the thought process a bit. And then the other thing, second thing, Lunger Holdings, if you could give us kind of the meaning for that. It's lungerholdings.com, by the way. But yeah, please go ahead.
Yeah. No, I appreciate it. So, quickly, my background is group professional as a scientist, did a PhD postdoc in computational biophysics, and then ended up in Silicon Valley working at a venture capital firm, right? Learned the private markets of the world, had a thesis in healthcare, health tech investing, co-founded a health tech company going after the primary care space, and ended up in finance at a bank. Cut my teeth there, learning both public and private markets, realized that there was this miscategorization issue where all these companies that exist, at least in the healthcare industry, it's across every sector, but we'll just pick on healthcare for this conversation. They advertise their business model might be in one sector, but they'll use certain keywords in their SEC docs or in the press to get earned media, which then has caused them to get misclassified. And that misclassification then trickles up into the public markets, into the ETF world, which we'll talk more about today, which is how you and I got connected. But that was sort of the motivation for starting, as you mentioned, Lunger Holdings. So Lunger, the meaning of the word is, it's a Punjabi word. So if you're not looking at video right now, Suraj is currently talking to an Indian guy, Punjabi guy, and we're talking about Lunger means community. It's community kitchen within a temple. And what it means is that if you go there in your time of need, independent of your race, ethnicity, caste, income level, you go there, you will sit on the floor and they will serve you food. So they treat you in a very unbiased manner. You can go there asking for clothes if you're a new immigrant, for example, right? And you'll get clothes and whatnot. It's all free. It's some of the most delicious food I've ever had in my entire life. But it means a community, right? Community kitchen, that type of community. So we said, look, an ETF, we're evaluating these companies in an unbiased manner. We're a community of experts, and we're building a community where you can invest. So at the end of the day, then Lunger sort of fit the bill.
Very interesting.
The company. And the trademark is available, the .com is available, sort of checked all those boxes in the end of the day.
So first of all, I told you guys he's a smart guy. You heard his credentials. In terms of these Lungers, these are places in India?
You can get them here in the United States. Just go to any what's known as a Sikh temple. You can go there. Typically it's on a Sundays, but I think in India it's every day, but at least I'm in LA right now. So the one I will sometimes go to when I want to get out of the apartment, it's a Sunday at noon. You get a free food, sit on the floor. And it's all volunteer. My dad came out recently to visit, and he actually then participated in serving people food. And it's all walks of life. Come in and just sit down, eat food for 20, 30 minutes, talk, and then you go about your day. But it's all free and again, very delicious.
Nice. I love it. I think that's a good for humanity, that kind of stuff. And then the name certainly fits. So that's Lunger Holdings, so LANGAR Holdings.com. I can show the website a bit later. But Dhruv, you and I connected again. It's been like a year and a quarter now at this point ago, and we I think we hit it off pretty quickly, kind of talking about the miscategorization. I think is the term you used of some companies and ETFs. And by the way, that's not just in healthcare; that's pretty widespread. But I think before we get into that, give us sort of your lay of the land in terms of the concentration And maybe that's a result of some of this miscategorization. And if you want to sprinkle in sort of the broader view on the markets, because I know you and I very much agree, our listeners certainly know my views on the sort of the Mag 7 concentration, which has hijacked most 401ks. But maybe give us a bit of perspective on your end, and then we'll start talking AI, I promise.
Yeah. So look, one of the things that you have to think about, and when you're looking at the public markets and the ETF industry, is that the vast majority of it is historically done by algorithms, right? And generalists, right? So we're just putting up tags of how things are classified, and they're running them through algorithms and building them those model portfolios that way.
Yeah.
Now, while that has worked historically, right, in the end of the day, because you had a very rigorous process, for example, for a company to go public, right? So when you think about it, the IPO process, as you and I both know, it's basically a due diligence process, right? Of saying, okay, this is a very good structured company, now they can go public. What has happened in the last several years is you're now seeing, well, there's an abundance of private companies that have unknown clear valuations, if they're overvalued or undervalued. And on top of that, there are a lot of different routes now to go public. So all that has led to a very messy public markets, is what I say, right? You have good companies, bad companies. You don't know what's going on. It's all controlled by algorithms, right? And now all of a sudden, you have clear winners, is what you're saying, right? Is that you have the top 7 companies, right, in the broad market are controlling everything. Right. And if they dip by 20%, we saw one of those companies dip early this year in January by 20% in one day, the entire market takes it back. And while historically that's been good for returns in terms of the set it and forget it mentality, it has now led to actually risk of people's portfolio. To your point of the 401ks point is that, like, one of my top holdings is actually Tesla. Sorry, I actually don't even own Tesla stock. I just own it through so many different funds.
Yeah,
I didn't know that 7% of my net worth that's liquid is currently sitting in Tesla in the end of the day. So people don't realize how concentrated they even are, right? And this just has compounding effects because of social media now saying, hey, go buy this ETF, that ETF. They might be marketed differently, but if you go look at the underlying holdings, it's the same 7, 10 companies, but that's where the majority of returns have come from in a very passive aggregate way. Yeah. So that's where you're getting all this concentration risk, right? And while it's been good historically, I'm going to touch on AI, even though you asked this question of, like, because now those are the foundational AI companies. It's leading to this question in the markets of, well, that's just the foundational AI companies. What about the other AI companies that are out there in the end of the day?
Well, that'll be, I think, what we can dig into here. I will say, one of the things that I find, just to quickly sort of put maybe sort of the cherry on top of what you're saying, that you're an accidentally way overweight. In your case, I think you said Tesla. What concerns me way more than that accidental happening is when I point this out to people all day, every day. They do not care. That's to me is the ultimate problem we're having. They're aware of it. They read about it. They hear about it. They do not care. They're not making a change.
Let me ask this. Do you believe they don't care because it's going up? Or are they just honestly, for lack of a better word, lazy, and they don't want to sit down and do the work to try and figure out?
There's both, and what we know from the average investor, and this is to some extent excluding the sort of the top, decile maybe of the professional community, but a lot of people now are do-it-yourselfers. There's a couple things. Some people cite tax they have to pay if it's a taxable account, which of course, if they did math, they would understand that that's not exactly the way I look at it. I can understand that there's a lack of education there. That's fine. It's a laziness thing, but it's very specifically, it keeps going up, and the mentality of, I can get out when it no longer goes up. And that, of course, is the biggest fallacy of all. But again, people are tired.
Good luck trying to time the market.
Well, people will be tired of me saying this, but it's people will react to this way too late, and that's the problem. They are not going to make a change in time, and so anyway, we'll find out. But let's maybe switch to a more optimistic sort of point of view, and that is AI. Now, you're in the business of managing money in the healthcare space. Maybe you can give us a couple of words on that to kind of lead us off. But very specifically, is sort of the AI layer and the misclassification that you mentioned before, I think would be very interesting for people to kind of hear from you at this point.
Yeah, no, I appreciate it. So look, let's take a step back for the listeners, right? If you don't realize it, 17% of the U.S. GDP is healthcare. expenditure in the end of the day. Now, it's over 4 trillion now in expense. But one of the first things we did in my career when I got into the outside of academia, and we did this within Lunger with our very sophisticated investment team, is we mapped out where is that $4 trillion going, right? And so, this is public information in the United States. CMS, Center for Medicare and Medicaid Services, puts out an actual report that says healthcare is going to cost $4.2 trillion, this year. They break it down to, say, 50 different buckets of where the expenses are. So hospital expenditures, for example, right, medical devices, durable equipment, etc. My team and I broke it out, Serge, into 500 different buckets. We tracked where every freaking dollar is spent in the U.S. healthcare system. And that can then be used as a model for other healthcare systems, right? So, for example, 4.2 trillion is an aggregate. Of that, 25% of it goes into hospital expenditures. Of that, you can then break out hospitals and say what goes into the OR versus a primary care visit versus an emergency room, right, cost. And what you're going to learn, for example, is take for the emergency room, it's 350 billion, which is not an insignificant number. So you say, okay, the emergency room costs in aggregate in the nation, 350 billion. How much of that is unnecessary, avoidable, or preventable? And what I mean by that is, say after this podcast, I go run into the wall and I jam my pinky. Do I need to go to the ER for that? Probably not, right? I can just go talk to my primary care doctor, maybe a telemedicine visit. I'll be like, look, just go ice the thing. If it's not broken, go from there, right? But what ends up happening is those are the examples of unnecessary visits where it's like, hey, you're going to the ER for something nonsensical, and that just causes more expenditures into the system. All right, so that gives a lay of land of how much healthcare contributes to the United States healthcare system. And then what we did is we tracked how much inefficient spending there is of that 4.2 trillion, for example, right? It's about $1 trillion. So 25% of the United States healthcare system is actually unnecessary, is avoidable, unnecessary, right? It's inefficient. It can be automated or replaced using technology, right? Made more efficient. So that gives you sort of a TAM, total addressable market. Is there are these companies out there that are now solving these pain points for $1 trillion market in the end of the day, right? And these companies, how we define them within Lunger is they're called health tech companies. Now, to do a level set, we define health tech as 51% of your revenue has to be coming from a tech-enabled product or service that addresses a pain point for a patient, provider, payer, or hospital system, and there has to be an AI component. So I'll ask you this. There are 6,000 globally classified healthcare companies by third-party rating agencies. Cannabis is called a healthcare company, all right? It's very, very silly. And my question to you, Serge, is, Price is Right rules. Of those 6,000, how many of them do you think are actually health tech by our definition? So to be clear, my team and I went through all these SEC docs, and we broke out the revenue breakdown of these companies. Said 51% of your revenue has to be coming from a tech-enabled product or service, right? So, for example, the company that's selling, surgical equipment like gloves and whatnot to a hospital, where that's the majority of their revenue, and 20% of it's coming from some software, but they're using the words healthcare technology, does not count. Right? So we broke it out. How many do you think of the 6,000 are actually health tech that are public? You tell me. Price is Right.
Gosh, I don't know, 10%?
No. So you got one of the closest. You still don't get on stage to keep going. So there's about 80 to 85 companies that are currently public that fit that definition. That's it.
Wow.
Now, that kind of goes back to this miscategorization issue that we're talking about, right? And now this has compounding effects. Because what we started this conversation about was how you're already over-concentrated. Yep. Well, how do you fix over-concentration? In one word, it's diversification. Mm-hmm. It's what we've always known from the very beginning is go pick, some of the top hedge fund guys and wealth managers will say, just go pick 8 uncorrelated asset classes, protect your downside risk. Yep. The upside will take care of it, right? So here are some numbers for you. 40% of the ETF industry overlaps with itself. And that is 40% of ETF funds have the same large cap companies in that. And just to be clear, my source for that number, we haven't done this analysis internally. It's way too complicated. We've spoken to some ETF experts like Bloomberg reporters and whatnot. And that's sort of the number they've shared with us. It's on social media. So the point is 40% of the industry overlaps with one another. That has compounding effects now because of miscategorization. So these non-healthcare companies or health tech companies are actually now in a healthcare fund all of a sudden, but they're just classified that way. What is the freaking modern day investor supposed to do?
Well, you can take Apple, for example, which I actually did this exercise. I'm going to say, I think it was early this summer. And I didn't obviously go. I can't just like you. I can't go through all the whole thing, but I did a very simple analysis. And I was looking kind of like what are some of the top, like I think it's the top like 30, 40 ETFs that hold Apple. Most of those ETFs had nothing to do with tech.
Yeah. Apple is last I checked, they were in a very predominant company had published a healthcare technology ETF. Apple was a top 10 holding, and I'm going, if you just go read Apple's public SEC breakdown, and then just they don't break down every single revenue line, but just do basic math here, guys. Like the Apple Watch functionality alone is not it's not making a healthcare company in the end of the day. Like they're doing billions of dollars of sales on the iPhones and AirPods. Like, what are you talking about?
Yeah, no, it's fascinating. But let's kind of focus, and so I think sets the stage, I think, really well. But let's talk a little bit about AI a bit more specifically, because obviously that's the raging bull market that people care about and only care about this. But as much as I'm sort of being cynical about it, or at least I kind of try to be a bit sarcastic about it, and I think for good reason, both you and I are pointing out some, I would argue, obviously some valid points. There is a lot of reason to be optimistic about, right? So tell us a little bit about some of the opportunities that you are seeing within that space that that you're sort of excited about.
Yeah. So look, the first thing we have to learn about AI, right? And I'm sure the listeners who are listening to this are somewhat rolling their eyes. To be clear, just go back to misclassification. Everyone's going to be called an AI company, and this is why you need a team of experts to sit down and say, what's the nuance here? Is there actual business relevance and impact of this company implementing AI? And in healthcare, what's the clinical impact of these companies? And if those two things don't have a big, massive green check next to them, then that is not a relevant company that you should be investing in. And that's what we've done, right? So some exciting applications. I leave out company names just from a compliance standpoint, Serge. Otherwise, my compliance guy's going to punch me in the face. So, I'll tell you some more about the subsectors that we're seeing within health tech. So, one is robotic surgery, right? And so you have these robotic surgery companies that, historically have been doing, hardware devices, but think of the software that goes into them. And again, this is all public information. You go read the earnings calls, and it's beautiful. They're going, look, you can do computer vision, to figure out if a clot happens or not in real time. That comes later. Some of the first applications we're seeing within robotic surgery is saying, hey, Serge, you go in for a routine surgery, this lasts, say, an hour, hour and a half, but it takes 3 hours. Why? It flags you on the back end. Was additional bleeding? Was there something that has that affect post-op treatment plans? Another company, right, which if you've ever had broken a bone or ever had to have a CT scan or MRI machine, predominant supplier of that globally, right, they're doing better image reconstruction. So again, they're not trying to do better image analysis. They're just saying when you do that CT scan or MRI machine, we can use AI to get higher quality pictures. If you have higher quality pictures, that means a surgeon goes in to annotate it, spends less time, or doesn't have to do a second or third read. That saves their time. If you save a surgeon's time, that's where the money is made in a hospital. Guess what? They can do more surgeries, or they'll be better residents that have higher outcomes in their surgeries. And the third example is in ultrasounds. One of the market leaders, $30 billion company, is going, look, we're doing ultrasound technology. When you have, when a woman is pregnant, you go in to do ultrasound, right, of the belly, and you measure the circumference of a baby's head. That takes 10 to 15 minutes. You can now automate that. That saves 10 to 15 minutes per visit. Guess what? I can see more patients. The hospital can make more revenue. And that's just tip of the iceberg, right? This is all phase one. In the end of the day, of what we're seeing from the AI standpoint. Wait till we get to phase 2, phase 3, and what's coming forward.
So you're touching on, I think, if I were to kind of summarize just this initial bit here a little bit, we talk about some of the major leaders in what we know as AI now, which are the chip makers, and I'm going to argue that the hyperscalers might fall into that category. But there's a lot of stuff that we can't even begin to think about just yet, right? We may refer this to as the application layer to some extent, or whatever we want to call it, where in the end the real sort of amazing opportunities will be happening. And so I don't think I'm definitely not trying to put words in your mouth, but I don't think neither you or I are saying that AI is going away, or in fact quite the opposite. It's just that there's a market concentration issue we have. Again, just quickly summarizing, going back to the initial point, that's basically in a few stocks. Again, nothing new. I talk about it every day, probably 15 times. However, again, to be opportunistic about it, or excited about it, there's a lot of opportunity in AI that is just beginning to emerge, and cost savings and so on and so forth are there. Um, that's on the ETF side. Now, and again, I know we have to be careful about the compliance, but to what extent can your can I say that's an ETF? I'm not
Yeah,
saying a
absolutely.
ticker. Yeah. That you to what extent is your ETF strategy or your ETF
Yeah.
different from what you would consider to be a classic sort of healthcare ETF?
Yeah. So think about it this way, right? To sort of tie all this together, is that your Mag 7 are these foundational AI companies in the end
Yep.
of the day. And that they're going to move up into the application layer. It's not a question of if, it's a question of when,
Yep.
right? So, for example, those companies are going to start. Think about it this way: the last big technological innovation we had, right? Forget the cloud, for instance, is the iPhone. Everything went mobile, right? So what happened is you had all these mobile apps, right? You had I don't know how many apps for like weather in the end of the day, and guess what? The foundational company for the smartphone, Apple, just has a widget now for your weather. I don't even know what happened to those apps, right? They all went bankrupt.
Yeah.
So that's what's going to happen in the AI side, is that you have your Mag 7, foundation AI companies. They move app into the application layer. They're going to dominate generalist applications. Cool. So that who wins? To your point, you're talking about sort of the AI application layer. It is these vertical specific deep domain companies that have the data, they have the budget to build these things, and they have the distribution. It's the incumbents. And
Yep.
that's what you're seeing for the first time ever in the healthcare industry, is that these incumbents used to buy companies that were innovative. Now they're going, screw that, we can just do this
Yeah.
ourselves.
Yeah.
It's cheap enough. We already have the distribution, right? Why in the world do we need to acquire a company where
Yeah.
we can just take them out?
Yeah.
And so, to your point, how are we different, right? One is that strategy of saying we're investing in the application layer of AI, right? We're not looking at big pharma, big insurance, big device companies. Those are all the legacy companies at the end of the day. And their business models are not innovative. They're more sales distribution arms in the end of the day, right? Realize that it is the small mid cap biopharma company that is the innovative one that gets acquired by big pharma. And then big pharma then takes it to billions of dollars of revenue, right? In the end of the day. That's a sales distribution channel in the end of the day. So that's one, is just how the thesis is different. And then two is our top 10 holdings are not small cap companies. We're an all cap fund. We include large cap, mid cap, small cap. But the top 10 holdings are the large cap. And I say, look, that's who's winning at the AI race in the next phase one. It's the guys who are already worth $100 billion that have all of this data, have all this information, they already have the moats. That's where you want to be parking your money in the end of the day,
Yep.
in our opinion.
Yeah. No, of course, of course. To what extent would you say that if I were to sort of classify your ETF or your strategy, which is the ETF, as a healthcare strategy that focuses on AI, is there a percentage you could assign to that? Because it's obviously not 100%, right? It's not all AI, although I'm sure AI, just by the virtue of what you said before, is going to be everywhere, right?
Yeah,
You
yeah.
could.
I love this question. So the actual answer is it's 100%.
I was going to say. I
We
was
are
going to think that. Yeah.
we are a active pure play health tech ETF, to be clear. So pure play, right? What does that mean? All of our holdings have meet our thesis. We don't have any nonsense in there. And this kind of goes back to when we were starting Lunger. It's my company. We were looking at how the ETFs, these funds were created. It's like, 80% of our portfolio is going to fit our thesis. 60% of our portfolio is going to fit our thesis. Everybody kind of gives some their wiggle room. And I'm going, this is all complete nonsense, right?
Mm-hmm.
Because you mentioned Apple earlier. I'll give you another company that just went private, Walgreens, right? So people are coming after me like, hey, Walgreens, they're doing a lot of stuff in primary care. They should be in the fund.
Yeah.
We did the homework, went through, looked at the revenue breakdown. Yeah, they might be doing primary care. They're also selling dog food and other things in the retail store. So
Yeah.
that's not a pure play company, right? In the end of the day. And so we said, look, if you're going to create a fund, it needs to be pure play, because the point is, and this kind of goes back to what we've been talking about today, is how do you handle this overexposure we have that we're not going to sell out of the Mag 7? Again, diversification. How do you ensure diversification? You buy a bunch of pure play strategies. They give you targeted exposure to a given thesis. And that's what we're doing.
Yeah. Very interesting. How when you look at sort of the healthcare sector in general, because I think as a non-specialist, as more of a generalist on the investment side, most people would say, "Oh, I need to buy some healthcare stocks, so I'm going to buy the sector
Right.
ETF or something of the S&P 500." How 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 do they break down in terms of sort of obviously there's the primary care and the hospitals and the whatever's in there, the insurances. How to what extent are they AI focused? And again,
Yeah.
obviously, to your point, everything goes AI. So this may be a bit of a difficult question, but I think
No, no. So
you should. I'm
what you're
going.
getting after is kind of going to this misclassification thing. So,
Yep,
so to
exactly.
be crystal clear for the listeners, we use a third party firm called ETFaction.com. I want
Mm-hmm.
to give them a shout out because they're like freaking awesome. It's also we have a free account with them,
Mm-hmm.
but you can look at overlap between two funds, right? So what you're getting after is like, for example, in just a broad like healthcare index, right? How much of those companies are actually health tech? I can tell you right now, it's less than 10%.
Yeah.
8% is what the actual number is. If you look at the broad market, top 500 companies,
Yeah.
it's 1%
Mm-hmm.
in the end of the day, right? So just speak to the healthcare focus. So that's what your question was about. So 8% of it's health tech. The rest of it is big pharma, big insurances in there. But
Yeah.
you also find like REITs that own the land a hospital is on,
Yep.
or like the management companies for nursing homes
Yeah.
is in there. There are some funds that have chemistry companies that are doing laboratory type research,
Yeah.
right? They're doing it in the name of diversification. For the listeners, I'm putting up air quotes for diversification. But again, it comes at a cost of, well, you now own the entire sector, right? You own all this stuff. Do you need to be owning these things? Like in the end of the day, some of these things have terrible business models. Like why?
Yeah.
In the end of the day, right? Is what it comes down to. And that's one of the reasons why, just look at broadly about healthcare this year, the sentiment has been negative because because the key players have had these lawsuits against them. We don't hold any of those companies, so we've been perfectly fine. But the point is that that's the risk of having all this miscategorization and this broad sector diversification, right? Of companies that when you have one or two of these companies just start going south for whatever reason, right? It's broadly affecting everyone's portfolio.
So then you're back at that over concentration issue that we mentioned before, right?
Exactly.
Yep. Well, it sounds like you see exciting opportunities ahead. How do you? Well, maybe we can kind of wrap up on this. What is your sort of? How do you forecast the timing to be? And I know this is not about timing. It's not a timing question, as you'll see, but the rate of change, I think, is more kind of what I'm getting at. I mean, some of these things, some of the examples you gave before with measuring, the head of a baby or whatever, all that kind of stuff. I mean, what's the time frame of some of that stuff to become a reality? I mean, I know it already is, right? But like,
Right.
there's got to be some sort of rate of acceleration that is probably increasing, right? I would imagine.
So this is where the big question is, right? And I can't give you a rate in terms of like months, years.
No,
All I
no,
can
I'm not. That's what I'm saying. I'm not looking for that. I'm
Yeah.
just kind of getting people's minds around
Right.
it.
So here's a framing reference for you, right? Is what we are doing right now is we are training AI models on the current hardware that's available, right? So when Elon Musk puts together 100,000 supercluster, right? If he goes to a million, whatever, we haven't hit that upper limit from a hardware standpoint, right? So when you hit an upper limit on the hardware standpoint, then you're going to have all these applications that come out saying, okay, great, here are what the finite number of applications can be. The most exciting thing about the AI side is that we haven't even hit the hardware limit yet. So the applications you're seeing today, that's the worst they're ever going to be.
Yeah.
Because as people build bigger and bigger chip clusters, as NVIDIA puts out better and more sophisticated chips, guess what? These applications are already going to have, you're going to get more applications and also going to get smarter applications in the end of the day, right? So that's when the news article first hits, right? I don't know when that's going to happen in the future or at what chip size or cluster size is going to be that says, we've hit the hardware limit. We can no longer scale. We've hit the energy output limit. We can no longer scale the hardware side. That's going to be like, okay, great. Now we've hit one limit. Now the question becomes is what are all the applications that can be developed off of that, right? Then you have to hit that limit. And when that limit gets hit, then you're like, okay, fine. AI technological revolution is now kind of like over. Find the next thing, right? But as far as I'm concerned, we're like in first inning territory still in all of
As
this,
far
right?
as AI is concerned.
Yeah,
Yeah. Yeah. No,
exactly.
it does make a lot of sense. I will throw in that I think maybe from sort of the Mag 7 perspective, I actually call them AI utility companies. I think that's kind of where they're
Yeah.
going. I would argue we're not in the first inning anymore. I think that's
Right.
a much later stage, but particularly from an allocation perspective, right? That's
That
and
I completely agree with you. Right. I was talking about AI
yeah,
application
no,
layer.
I know. I'm just trying to just clarify people because sometimes people, do something and then they chime in. They're like, "Oh, he said this," but no, he really didn't say that because that's not you didn't listen to 90% of the conversation. So I
Right.
try to bring it back. I've learned, ADD out there is a thing. But no, very interesting, Drew. And again, if you guys want to find out more about Drew and his ETF, you can go to Langar, Langar funds funds.com. Any last thoughts from you?
No, look, it's an exciting time to be in the public markets and investing and like learning about all this stuff, right? That sort of when you're looking at what's going on, it's always very interesting saying, this stuff used to be theoretical even a couple of years ago. And now you're actually seeing, again, incumbents, right? Historically have not really been innovative, but they're going, look, here is the partnership we're striking with a Mag 7 company, and we're already doing this, and we're already starting to see outcomes from all of it, right? So it's a very exciting time to be in this industry in the end of the day.
It is a very exciting industry. We see it ourselves how it's transforming things, and it's transforming things at an increasing speed. So
Yeah.
I think that's kind of where we're at. So anyway, Drew, thank you so much for being here. It's been a real pleasure, and I hope to all the listeners that you learned something about AI, about the concentration risk, and maybe where AI from an investment perspective is heading. Thanks for listening. I'll see you guys in the next Study Wealth podcast. If this video helped you, please make sure you subscribe to the channel, you give us a thumbs up like, and if you want to see this approach in action, you will want to join us in our Set the Market morning call, which happens at 9 o'clock Eastern Time, Monday through Thursday. Make sure you join us for that in the link down below. Again, subscribe to the channel. I'll see you in the next video.